My name is Sister Mary Scullion, and I'm with the Project Home community. And on behalf of the residents, staff, and trustees of Project Home, Joe McConnon and I extend to you a very warm welcome to all our guests and dignitaries. We're really thrilled that you're here. From our earliest days, we have sought to provide housing, education, employment, and health care to empower people to break the cycle of homelessness and poverty. And the Stephen Klein Wellness Center is the best expression of this core commitment to health. We believe that we can end and prevent homelessness. When Project Home started 25 years ago, if someone had stood on this street and said that abandoned houses would be rehabbed to provide affordable home ownership for families, that the Honickman Learning Center and Comcast Technology Labs would stand as a shining light for education and workforce development on the 1900 block of Judson Street, that youth who were homeless are now going to college and graduating, that this entire block would be transformed into an older adult center and the Stephen Klein Wellness Center, people would have been very, very skeptical. But today, we are celebrating what once seemed impossible as possible. Because of you, because of every single person that is here, because of a partnership with the city, state, and federal government, Democrat and Republican, with the support of PNC Bank, Claire Harrison Harvey Brandsburg Law Firm, Regional Housing Legal Services, and with the invaluable partnership of Thomas Jefferson University and Hospital, the YMCA, and the phenomenal leadership and generosity of Steve Klein, Leigh and John Middleton, and Elizabeth Moran, this state-of-the-art health home and older center will become a reality in North Central Philadelphia. This center is a game changer, and it's due to the hard and persistent work of literally thousands of ordinary people doing extraordinary things. People every single day making decisions for recovery, education, health, and community, coupled with God's grace. This is a celebration of the power of we. It's a celebration of collaborations, partnerships, and relationships. It is a celebration of faith and hard work of a diverse community of people committed to social change, the dignity of every single person, and transformation. The Project Home community advocates for just public policies, including policies that ensures health care access for all people. We know that affordable housing, health care, education, and employment not only saves lives, but it saves money. We believe that in the addition to the efforts of the private sector, the public sector at all levels must play a role to that end. And that is why we are glad to welcome all of you here today, because it is only in working together that we've been able to realize the dream of these centers. And it is only in continuing to work together that we will realize the greater dream of ensuring health care for every citizen and an end to homelessness for all. God stands squarely on the side of the poor and those who are suffering. We feel the urgency of homelessness and poverty on this bitter cold day today. So we commit, we act, and we pray. Glory be to God, whose power working in us can do infinitely more than we can ask or imagine. Amen. And now it's my pleasure to introduce to you Monica McCurdy, our Vice President of Healthcare Services.
Thank you. Today, we celebrate the start of construction on a beautiful new building. Thousands of work hours of many staff over the last 6 years or so led up to today's celebration. The beginning of this journey actually started almost 20 years ago when doctors Laura Carson Weinstein and James Plum from Jefferson's Department of Family and Community Medicine came to Project Home with their students and asked, how can we help? How can we be involved? With the steadfast support of their department chairs, formerly Richard Wender and now Christine Aronson, we are so glad that Jefferson came and stayed all these years. Their work has literally saved lives. Yes, that deserves applause. We are privileged to partner with 4 more outstanding organizations: Women Against Abuse, Einstein Hospital, Council for Relationships, and Pathways to Housing Philadelphia. The vision and passion for the Wellness Center rests squarely on the shoulders of an amazing team at St. Elizabeth's, both past and present. I am humbled and honored to work with these committed individuals every day. Would the Wellness Center Community Advisory Board, the Healthcare Committee of our Board of Trustees, and all of you out there, even if you're standing, wave, who work at St. E's now or in the past, please stand and remain standing so we can acknowledge you. Please stand. We are also really excited about the new partnership starting this year: Jefferson's Department of Pharmacy with Jefferson's Outpatient Rehab Services, Public Health Management Corporation, and the Philadelphia Freedom Valley YMCA. Our work would not be possible without the generous grant funds to support this work from the Independence Blue Cross Foundation, First Hospital, Keystone First, AmeriHealth Caritas, Curaterra Foundation, the Haas family, the Barra Foundation, the Independence Foundation, and the city's Department of Behavioral Health. And last, but certainly not least, Project Home is deeply appreciative to the U.S. Department of Health and Human Services, and specifically an agency within HHS known as HRSA, which stands for Health Resources and Services Administration. That's a mouthful. HRSA oversees a critical program that Project Home is thrilled to have joined in November. After a highly competitive process, we are part of a network of 1,300 other health centers throughout the country, known as Federally Qualified Health Centers, or FQHCs for short. FQHCs serve as the nation's safety net healthcare system for 21 million Americans. Without the FQHC designation, the shovel would not have been able to go into the ground at this time. The FQHC program is not just a federal program, it is also administered by our partners at the state, specifically the Pennsylvania's Department of Public Welfare. We look forward to working with Secretary Mackerath and Mr. Vince Gordon, Deputy Secretary of Medical Assistance Program, who I believe has traveled from Harrisburg to join us today. Thank you so much for coming. The people we see at St. E's experience many health disparities. They are disproportionately affected by diabetes, are at higher risk of dying at an earlier age, have higher rates of low birth weight, have higher rates of major depression, and lower utilization of dental care. Also, residents of this community face many uphill battles with chronic unemployment, low income, high stress, and chronic, often preventable health conditions. To reverse these disparities, the Wellness Center will offer comprehensive services supported by an electronic health record system. We will offer primary medical care, nurse care management, behavioral health, dental care, nutrition classes, healing touch, mindfulness classes, an in-house pharmacy, and a fitness center operated by the YMCA, where there will also be shared space with a physical therapy provider. It's not enough to provide these services under one roof. Our healthcare providers will step outside of our silos and work in an integrated way with each other and with the patients we serve. Because of the many federal, state, city, academic, philanthropic, managed care, and service partners who are with us on this journey, the possibilities are literally endless for us to create innovative and cost-effective healthcare delivery models. Thank you to all who have made this day possible and for reminding us of the important values that will be our guiding force into the future, namely the idea that all people matter, all people deserve affordable healthcare and the opportunity to become our best selves. And health really is our most precious resource. Thank you. I'm very happy to introduce Dr. Stephen Klasko. Last September, Dr. Klasko began his tenure as president of Thomas Jefferson University, as well as president and CEO of Thomas Jefferson University Health System. We are delighted he has returned to his hometown after serving leadership positions for several years as a dean and vice president at the University of South Florida. Please join me in welcoming Dr. Klasko.
Thank you, and I also want to thank you. If I needed a message that I'm not in South Florida anymore, this groundbreaking has done it. There's a lot of cynicism out there as to what government's role is in reducing inequality, whether or not the private sector can really make a difference for all of us in our community that are disadvantaged, and frankly, whether or not academic medical centers can really be a true asset to everyone in the community. Thanks to the amazing work of Sister Mary and her colleagues, thanks to the great support of this great governor and great mayor, thanks to great community leaders like Stephen Klein and the Heinekmans, today in Philadelphia, we are replacing that cynicism with great optimism. And I am so proud that Jefferson is a part of it. Jefferson's absolute mission to make sure that everyone has an opportunity for health does not come from the top. It does not start at the president. It is really part of our soul. When you rattled off some of the people that were involved in this, it was just a natural extension of what Jefferson has always been about. We've always been about making sure that everyone in our entire catchment area has the ability to prosper and be healthy. And as president of both the university and the hospital system, we're only going to extend that effort. Today, as a matter of fact, we signed an agreement to start a very innovative telehealth presence for the community. And the company that we work with made a commitment today that one of the first kiosks would be at the Stephen Klein Wellness Center. So I'm very proud of that, Sister Mary. So what you're going to see from the new Jefferson is a lot what you saw from the old Jefferson, only new. And it's going to be taking healthcare reform, turning it into healthcare transformation, whether that's through telehealth or whether that's through innovative models of healthcare. But it's going to retain that same commitment to healthcare for all. I'd like to paraphrase loosely what our great Eagles coach once said, and what I would say is, in Philadelphia, we don't just talk, we do. And the Stephen Klein Wellness Center could not be a better example of what we do and what will be really a paragon for the nation of really taking a grounds-up approach to really changing people's lives. Thank you, Sister Mary, and thank you for allowing Jefferson to be part of this.
Our next speaker is Loretta Dredden, who is a new member of our team at the St. Elizabeth's Wellness Center. She works as a community health worker and is also a consumer of our services. Loretta, we really appreciate your sharing experience and lending your skills and talents to our team. Please join me in welcoming Loretta.
Thank you, Monica. Good morning. My name is Loretta Dredden, and my journey with Project Homes began 2 years ago when I moved into Rowan home with my son and daughter. I was in recovery programs for 3 years before that, and I went through a process of regaining custody of my 2 youngest children. What I needed most was stable, permanent housing. Project Home offered me a safe and supportive environment in which to raise my family and to continue to pursue my recovery. By the grace of God, I completed 4 years of clean and sober. Thank you. Also through Project Home's resident intern program, I began working at the Homespun Resale Boutique at 15th and Fairmount, where I gained valuable work experience and it started earning a paycheck again. The first time that I came to St. Elizabeth Wellness Center, I was at a crisis point. I was having an asthma attack, I had high blood pressure and diabetes. I was low in my medication, and I did not have insurance. The Wellness Center staff made sure I was seen quickly, and they treated me with care and dignity. The staff and providers at the Wellness Center view everyone who walks in as a human being, not just another file to be checked off and put in a drawer. They know your name. They spend time with you, listen to your needs, and go above and beyond to give well-rounded care. I am proud to say that recently I joined the staff of Wellness Center as a community health worker. I am a bridge between the consumer and the provider, making sure that we understand the particular needs of each person so we can offer the best possible care. As part of my own recovery process, I became a certified peer specialist, which gave me the skills to accompany and empower others to seek their own wellness. I accompany our consumers on their journey towards health and wholeness because two is always better than one. I work closely with people who have diabetes, calling to make sure that they're taking their medication and checking their blood sugar. I make sure our providers know what's going on with that person, including physical and mental health issues, so that we can respond with all of their necessary resources. I am so excited to be here to see this new phase and growth of Wellness Center. This new facility and all of the new services that will be offered here will transform my community, my neighborhood, from a community of need to a community of wholeness. We have to spread the word that Stephen Klein Wellness Center is where it's at. Thank you for this opportunity to share in this exciting moment in Project Home history.